These are the session contents. Now, what is a sample? It's a subset of population, and we draw some conclusion based on the sample, and we extrapolate the findings to the population. So this is sample. Now, why optimal sample size is needed? Now, if sample size is too less, what will happen if we repeat the same experiment? We will get unreliable results. One experiment with the same sample size will give some different findings. Other sample with less sample size will give different findings. There will be wide interval between them, or reliability will be very less. And your confidence interval will be too wide if the sample is too less, and you cannot find significance, and your all efforts will be in vain. So if we are studying any research study with too less sample size, our purpose will be defeated. And if it is too much than the optimal size, it will increase the cost, it will burn our resources. And if it, particularly for clinical trials, there are some ethical problems, because we have to give some new drugs with increased sample size. There are ethical problems. And with too much of sample size, we can get the significant results, statistical significant, even if there is not, the results are not clinically significant. For example, if decrease in blood pressure with an antihypertensive is just 1 mm of Hg, with difference is 1 mm of Hg, which is of not that much of clinical significance, but with the very big, large sample size, such type of findings may have significant results. So if too much sample size is there, we can get significant results irrespective of clinical significance. That's why too much of sample size and too less of sample size is not good. We have to go for optimal sample size. Why? Because with optimal sample size, our resources will be utilized properly, confidence interval will be optimally narrow, and we can find the significance, and the purpose will be served. Now, what determines the sample size? Now, as I have already said, I have divided the scenarios into two main parts to make it easier for you people to determine the sample size. So the objectives are divided into two parts. First part is when you want to accurately estimate something with specified precision. Here you are not applying any statistical test of significance. You are just estimating a population parameter such as proportion or prevalence of a disease, or mean of something in the population, or odds ratio, or relative risks, or R correlation coefficient. So in this scenario, we are actually estimating, we want to estimate something, some population parameter with specified precision. For example, we want to estimate the proportion of smokers in a population, and we want to estimate that proportion within the precision of 10. Means if the actual proportion is 50, we want to have results between 40 and 60. So this is 10 is the specified precision, or it is also called as allowable error. So this is the first scenario where we want to estimate something with specified precision. And second scenario is you want to compare two or more groups and find significance. Here we apply some test of significance and find it out whether these two groups are significantly different, or the means or proportions of these two groups are significantly different than each other. For example, in case control studies, we compare the exposure rates in two groups, in case group and control group, or in cohort study, we compare the incidence rates in exposed group and non-exposed group. In clinical trials, we compare the success rates of treatment A versus placebo, or treatment A versus treatment B, etc. We'll see it in detail, the various types of clinical trials afterwards. Or any two means, or any two proportions, or more than two means, such as in ANOVA, or more than two proportions, such as in chi-square test. So these are the two main scenarios where we want to estimate the sample size, where we want to estimate population parameter, and where we want to apply a test of significance. So first step in calculating a sample size is to identify what exactly is the objective and what that objective intends to do. So in this example, suppose your objective is to determine the prevalence of smoking amongst medical students. So here, what we are doing, we are estimating the prevalence, with specified precision. If the actual prevalence is 20% and the specified precision is 5%, then we want that our study should give results between 15 and 25. So this is the estimation of something with specified precision. Now, if our objective is not only to find out the prevalence of smoking, but also to find out the factors affecting smoking status in medical students. For example, whether the stay affects the smoking status, whether the stay in hostel increases the risk of smoking habit. In this scenario, we'll compare the two proportions, means how much is the proportion of smokers in hostelites, suppose it is 30%, and how much is the proportion of smokers in localites, suppose it is less because they are staying at home, it is only 10%. And whether this proportion is significantly different than each other, we will test it. And this is the second objective, and another objective where we are applying test of significance. Or another example is academic year, whether the proportion of smokers in first year is significantly less than proportion of smokers in final year. That also can be an objective. Another objective can be post-operative complications for cholecystectomy and factors affecting them. This can be a thesis topic. The proportion of post-operative complications for cholecystectomy and what are the factors affecting them. So in this research study, there are mainly two objectives. First objective is to estimate the proportion of complications, and second main objective is to identify the risk factors for complications, and possible risk factors can be gender, age, other comorbidities, means whether the rate of complications differ gender wise, whether the mean age of complications, I mean patients who have experienced complications differ, then and other comorbidities. So in this research study, there are more than one objectives. And if there are more than one objectives, then how to estimate sample size? We'll see. The first step is to just enlist all the objectives like this. First objective is to estimate proportion. Second objective is to identify risk factors, and these are the possible risk factors. Next is prevalence of diabetes amongst doctors. So the objective here is to estimate prevalence of diabetes amongst doctors with specified precision. And sometimes these two objectives can be clubbed, like prevalence and risk factors for diabetes amongst doctors. So if this is a research study, then there are multiple objectives like estimating prevalence as well as identifying risk factors. And these are the possible risk factors like gender, which branch of doctors is there, place of practice, whether rural or urban, depending on so many risk factors we can identify, and you can study, and you can conduct a case control study to identify the risk factors. And for each of the risk factor identified, you will calculate the odds ratio and test whether it is significantly different than one. And sometimes, very rarely, you want to estimate the odds ratio with specified precision also. So finally, when you want to estimate sample size, you have to just enumerate the objectives, whether the objectives are estimating something and whether the objectives are testing some difference between two or more means, or difference between two or more proportions, and estimation of sample size will be different in each of the scenario. Then in clinical trials also, we can do this type of study, efficacy of treatment A as compared with treatment B. There are different types of clinical trials, such as superiority design or non-inferiority design. I will explain in detail what are these type of, what do we exactly mean superiority design, non-inferiority design, equivalence trial afterwards. Now we'll actually see how to estimate sample size in two scenarios and what information is required for these two scenarios. When we want to estimate something, the required information is the guesstimate of the parameter. Guesstimate means a guess or a approximate estimate, depending on the previous studies, what previous studies have shown, or if previous studies are not available, based on the pilot studies conducted in the same population, you can have some guesstimate or guess or estimate of the parameter. For example, if you want to estimate the proportion of smokers, you must know how much is the guess proportion of smokers in your population. Precision or allowable error means if the population proportion is 50 and your allowable error is 10, it means that your study should give the results between 40 and 60. Here 10, there 10. So it is the allowable error. And third one is the confidence interval or alpha. It means confidence interval is usually it is taken as 95%, or if confidence interval is 95%, alpha is 5%. I'm not going into the mathematical details or conceptual statistical details of those things. You know very well what is confidence interval or alpha. So you must know these three things if you want to estimate the any population parameter. If you want to estimate the sample size wherein there is comparison of two or more groups, or comparison of two means specifically, then you must have the guesstimate of mean and SD in each group. So there are two groups. That means you must have the ratio of sample sizes in group 1 and group 2. Mean how much, if the group 1 is having 100, you intend to have 100%, and group 2 you intend to have 200%, means ratio is 1:2. So you must specify the ratio of sample sizes, confidence level. Power is the strength of the test to catch the significance. And I'm not going into the details of that. Tails, one tail test or two tail test. Whenever you want to test whether two means or two proportions are significantly different, it means it is a two tail test. Whenever it is specified that whether one is significantly more or significantly less, then it is a one-tailed test. So it's very simple to identify. Significantly different, two-tailed. Significantly less or significantly more, one-tailed. One only one-sided, one-tailed test. Now the softwares available, free softwares such as G-Power is available, which is considered as the gold standard, but it's somewhat complex, not user-friendly. R is, it requires very exponential learning curve. Stiplan is also available. EP-Info is available with limited research designs. PS is there, and DRSM is also free of cost. The commercial softwares are SAS, Stata, PASS, Stats Direct. Free of the one version of Stats Direct is also available free of cost. We are using DRSM.in for this session. So this is the home screen for DRSM. In the home screen, you can see various facilities available on DRSM. You can use this for applying any significant test or regression analysis, etc., etc., etc. We are interested only in sample size calculation. So I'll click on sample size calculation, and these are the various options available depending on your objective. So your objective of the study will determine which facility will you use for estimation of your sample size. So we'll actually use, you will actually determine the sample size using some of the examples that I have prepared. So we'll actually start using the software to calculate the sample size. At this stage, I will request each one of you whether everything is clear to you what I have explained. If you have any queries, you can put in the chat box. I will be happy to answer all those queries. Okay. Shall I proceed?
Yes, sir.
Okay. Now we'll take examples one by one, how to calculate the sample size. Now this is, can you see both the screens? Means towards the left hand, there is a PDF file where examples are there. And towards the right, actually the website is there. I have opened the website. Can you see both the screens there?
Yes, sir.
Yes, sir.
Yes, sir.
Okay. Now this is the first example. I'll read this example and we'll go slow now. Now, this example, a study is planned with an objective to find prevalence of alcohol abuse in medical students. Previous studies have shown that the prevalence is 25%. How much sample size is required to find the prevalence with absolute allowable error of 10% at confidence level of 95%? So what we are doing in this, can anyone answer? Whether we are estimating something or we are applying a test of significance or we are comparing the groups. What we are doing here? Is anyone?
Estimating, sir.
We are
Estimating.
estimating what? We are estimating what?
Prevalence, sir.
Prevalence. Okay, or proportion. So if you look at the website, there is a first row, estimation of a parameter with specified precision, and here the link is given, estimation of proportion or prevalence with specified precision. I'm clicking on this link and it will be diverted to this web page, and you have to just fill the values which are given to you. Now, from where you can get these values? Now, here you have to identify only one value, the guesstimate of proportion from previous studies by review of literature. So, how much is the guesstimate of proportion of alcohol abuse in medical students given in this example? How much it is?
25%.
25. Okay. Confidence level is how much?
95.
Given is
95.
that we have to decide. It is 95, and you can universally you can take it at 95 confidence level, no problem with that. How much is the allowable error?
10%.
10%.
10%. Now, what does it mean?
5%.
What does it mean? It is the absolute allowable error is of 10.
Hmm.
Now, I will explain what is the difference between absolute allowable error and relative allowable error. So here it is specified that it is absolute allowable error. Can you see here? It is the absolute allowable error.
Yes.
Now, what does it mean? At confidence level of 95% and allowable error of 10, if we are estimating sample size, we will estimate the sample size and then I will interpret this. Now, how much is if I click on this calculate sample size, how much is the sample size? 73. Can you see here?
Yes, sir.
Okay. So what does it mean?
Yes, sir.
So if we do the same experiment in medical students for 100 times, out of that 100 times, for 95 times, means if your confidence interval is 95, so for 95 times, the proportion given by your study will be between 15 and 35. Understood? So this is the meaning of allowable error. 10 here, 10 there. So 15 to 35. This is absolute allowable error. So 10 here, 10 here, 10 there, absolute. Now what is relative allowable error? We'll see in the next example. This is the next example. A study is planned with an objective to find prevalence of alcohol abuse in medical students. Previous studies, everything is the same. Only difference is that the allowable error is not absolute, it is relative. Can you see here? So what does it mean? Relative to actual proportion. So 10% of 25. 10% of 25 is how much? It is 10% of 25 is 2.5% here and there. This is the meaning of relative allowable error. Relative to what is the actual proportion. So if allowable error is relative and it is 10%, it means it is relative to the actual proportion. So 2.5% here and 2.5% there. So in fact, 10% of relative allowable error is exactly equivalent to 2.5% of absolute allowable error. You got the point?
Yes, sir.
Yes.
Yes, sir.
Any question? So 20% of relative allowable error is equal to how much of absolute allowable error?
5.
5. That's correct. So we'll we'll select here relative, because in this example, we have given the allowable error as relative, and we'll click calculate sample size. Or now the sample size required is 1153. Now we'll cross check. We have already seen that the relative allowable error of 10 is exactly equal to how much absolute allowable error?
2.5.
2.5. So we'll check this, how much sample size is there. If we select absolute allowable error and allowable error put as 2.5. Now with the relative allowable error of 10, the sample size was 1153. We'll see what happens here. Here also the sample size required is exactly the same. So you understood the concept of relative and absolute allowable error?
Yes, sir.
Okay.
Yes, sir.
Yes. Next example. A study is planned to estimate mean systolic blood pressure of medical students in a city. A pilot study has shown it as 124 plus minus 10 mm of Hg. How much sample size is needed to correctly estimate the mean systolic blood pressure within 5 mm of Hg of its true value at alpha of 5%? Now, alpha of 5% is equivalent to confidence interval of how much?
95%.
95%. That's correct. So sometimes, because 90% of times, 95% of the times, your estimate will be within this, and alpha 5% means at 5% of the times it will be outside of this. So this is just opposite of confidence interval. So we'll go to the home page. Now here, what we are doing in this example, what we are doing?
Estimating the mean.
Estimating the mean. So we will use this estimation of a parameter with specified precision, first row, and this is the second column, estimation of a mean with specified precision. This link I will click. I'll be diverted to this page, and you have to just fill the things. Your guesstimate of standard deviation. How much is the standard here? Please
10.
remember, it's not the mean is asked, because sample size depends on the variability. I'll not go into the mathematical details of that, but just remember, if it is a ratio data, the sample size depends on the variability. So standard deviation, how much?
10.
10. Confidence
10.
interval is how much?
10.
Confidence
95.
level
5%.
95.
95.
Allowable error is how
95.
much? Allowable error is how much?
5%.
5.
5%.
5.
No, not percent. Here 5.
5.
Within.
5.
Estimate the mean systolic blood pressure within 5 mm of Hg. So it is 5. Okay. And we'll click on calculate sample size. How much is the sample size?
16.
16 is the sample size. Like in proportion, you can also select the relative allowable error. But if you select relative allowable error, another thing that is asked by the software, or that is required, that is your guesstimate of mean also. Because based on that mean, the absolute allowable error will be calculated, and then the sample size will be estimated, as we have done in the previous example. Shall I move ahead?
Yes, sir.
Okay. Now next. A case control study is planned to test the association between non-veg diet and appendicitis. Previous studies have estimated the odds ratio equal to 2.5 with exposure rate amongst disease is equal to 50%. Means those who suffered from appendicitis, 50% of them were non-vegetarians. How much sample size is needed in case and control group to correctly estimate odds ratio within 25% of its true value at 95% confidence level? And case to control ratio of sample is 1:1, means equal number of cases and controls you intend to have in your study. So what we are doing in this, whether we are estimating or we are applying any test?
Estimation.
Estimating.
Yes, we are estimating what?
Sample
Odds
size.
ratio.
Odds.
Means our objective is what? To estimate
Sample size.
odds ratio, and for that we will determine the sample size. Okay. So I will go to the home page of sample size, and here estimation of effect size in case control or cohort study with specified precision. Third row, can you see here?
Yes, sir.
Yes, sir.
Yes, sir.
So now I will click here. We want to, our objective is to correctly estimate odds ratio within 25% of its true value. Means if the odds ratio is 2, we want that our results will be in between 1.6 and 2.4. 0.4 here and 0.4 there. That means 20% of the actual odds ratio. So we will estimate, or we will determine the sample size for correctly estimation of odds ratio within 20% of its true value. I will click here, and you can see the things which are required as input. You need not to remember what information is required for estimation of sample size in different scenarios. You can just visit the web page, any software you can use, and you can just see what input it is asking. And based on that, you can gather the information, put those values, and you can determine the sample size. Now, coming to this example, how much is the confidence level in this
95.
example?
95.
95.
Allowable error is how much? We want to correctly estimate odds ratio within how much?
20%.
20%.
20%. So
20%.
allowable error is 20.
20%.
Ratio of controls
One.
to cases, how much?
1.
1.
1:1.
1.
Okay. So the ratio of controls to cases 1:1 means it is 1. Okay.
Hmm.
Now, for estimation of proportion, only guesstimate of proportion was sufficient. For estimation of mean, guesstimate of standard deviation was sufficient. But for estimation of odds ratio or relative risk, only guesstimate of odds ratio is not sufficient. One additional thing is required. How much is the exposure rates? Any one of exposure rates will do. So you can have, or you can give input for any two of these three available options. Odds ratio is the one option, proportion of cases exposed is the second option, and proportion of controls exposed is the third option. Any two of these three options, they are given as input. Third will be automatically calculated, and required sample size will be given by the software. Is it clear to you?
Yes, sir.
Yes, sir.
Yes,
Okay.
sir.
So what is given here?
Odds
Odds ratio.
Odds ratio is
And
given, so I will
cases
select
proportion of
odds
case
ratio.
exposed.
So this row is now visible. Your guesstimate of odds ratio, this is visible. And next is what?
And
Exposure rate
exposure
amongst
rate among
Disease.
disease
this means
Cases.
exposure rates of cases. Okay.
cases.
So for this row is also
Cases.
visible now. Okay. So I will give the input for that. How much is the guesstimate of odds ratio?
2.5.
2.5.
2.5. Then probability of exposure in cases means it's the exposure rate amongst
50%.
deceased. How much it is?
50%.
50%.
50%. Okay. So I will calculate the sample size, and sample size is 687 in each group.
Yes.
Okay. So sample size for first group is, means case group is 687. Next group is 600, and means the control group is 687. And this is very important because I have seen our thesis also, community medicine people thesis also, wherein they are conducting case control study and they are calculating sample size using the universal equation 4pq upon L square. This is absolutely wrong. If your your objective is to you are doing case control study, you have to estimate the sample size using the appropriate formula for case control study. So the required sample size for case control study is this 687 in each group. Now here I will give one hint. Suppose you think that these many number of cases, it is impossible to get these many. It is very difficult. It's first thing in final principle, that is your feasibility is not there, and you cannot have 687 cases. What you should do now? What you can do? Can you just guess? Because you cannot change the guesstimate of odds ratio. You cannot change the probability of exposure
Precision.
in case.
Precision
Yes,
is the
that is correct. You can in increase the allowable error. If you increase the allowable error, the sample size will be reduced. But you want, no, I will not compromise with the precision or allowable error. Or also I will not compromise with the confidence level. Then you can increase the control to case ratio. You can have 2 controls per case. So ratio of controls to case can be 2. Means you can increase the number of controls so that the required number of cases can be decreased. Now I am putting how many controls per case? How much I have put here?
2.
2.
Two.
And now we will see how much is the sample size. The sample size required is 687 previously with 1 control per case. Now if I click here, now it is reduced to how much? 498 without compromising the power of the study. If it is 3, then we'll see how much it is. 435. If it is 4, how much it is, we'll see. 404. But it is advised that you cannot have the ratio more than 4 because it will then it will not change the power of the study. Maximum up to 4 you can have the controls per case. Is it clear?
Yes, sir.
So for a case control study, this is the way to estimate or determine the sample size. For that, you need to have the guesstimate of odds ratio and probability of exposure in cases, or you can have probability of exposure in controls, and you can determine the required sample size. Next example. A study is planned to test whether there is significant difference in mean marks scored by boys and girls in NEET PG. A pilot study has revealed the mean marks in boys and girls are 340 plus minus 50 and 365 plus minus 50. How much sample size is needed for the same? At 95% confidence level, 80% power, and equal number of boys and girls in study. What we are doing here? We are estimating or we are applying some test?
Yes.
Test. We are means we are finding the
Significant
significant
difference.
difference. So hypothesis test. How many means are there?
2.
So you please do not look at the estimation. Look at what? Hypothesis testing. How many means are there?
2 means.
2 means. So whether they are
2.
dependent or totally independent means groups are totally independent. So that's why these are 2 independent means or 2 independent samples, isn't it?
Yes, sir.
So I will use this link, significant difference between 2 sample means. Understood?
Yes.
Yes, sir.
Okay, so I will use
Yes.
this link and now we'll put the required information. So how much the guesstimate of first sample mean? Can anybody
340.
tell me?
340.
340. Okay. And how much is the standard deviation of first sample
50.
mean?
50.
50.
50.
Second sample mean guesstimate?
365.
That's correct.
365.
Then standard
50.
deviation?
50.
That's correct. Ratio?
And 2.
1:1.
1.
1:1.
Because
One.
equal number of boys and girls
Yes,
in study.
one.
That is given. So 1. Confidence level?
95%.
95.
95.
Power is how much?
80%.
80%.
80%.
80%.
One-sided or two-sided then? Now this is important. One-sided or
Two-sided.
two-sided?
Two-sided.
Why?
Two-sided.
Why
Two-sided.
two-sided?
Two-sided.
Because
Why?
there is no less and more mentioned.
Yes. What is mentioned is whether there is significant difference.
Mhm.
So it is two-sided. Had it been like this, a study is planned to test whether the mean marks scored by boys are significantly less than the mean marks scored by girls. Because 340 versus 365. Then it is one-sided test. Okay, understood?
One.
Yes, sir.
Yes, sir.
So whenever
Yes.
it is given that it is whether there is significant difference, it is two-sided. And whenever it is given that whether it is significantly less or significantly more, then it is one-sided.
One-tailed.
Okay, one-tailed. That's one and the same. Yes. So then I will click on the Calculate sample size. Now, how much is the sample size? 63 in each
boys.
group. Okay. So this is the sample size required when we intend to compare the two means and we want to find out whether there is significant difference between these two means. Now, this is something rarely, but something advanced. Now, in this example, in what I have already explained, in which the sample size was 63, this our objective was to find it out whether there is significant difference between marks scored by boys and girls, isn't it? So whether there is significant difference, that's all. But somebody can ask, or you might have this objective also. How much is the exact difference between marks obtained by boys and girls quantitatively? If the actual difference is 25, I want to have results from my study that my study will give the difference within the allowable error. You understood? So now here in this example, the difference is how much? 340 versus 365. So difference is how much? Actual difference is
25.
25.
25.
25. 25. So my another objective is to estimate this difference within 10 marks of true difference. So if the difference is of 25, my study results should be such that the difference is in between 10 marks here. So 15 to 35.
35.
Okay. So this objective can also be there if you want to quantitatively estimate the difference in marks. And for this, you can use, now here there are dual objectives. One objective is to test the difference
Significant.
between two means, and another objective is to estimate that difference correctly. So these are two different objectives. Understood?
Yes, sir.
So
Yes.
in this
Yes.
scenario, we will use this. So we have seen first objective, significant difference. So in that sample size was 63. And now we will calculate the sample size required for second objective to estimate the correct difference in marks within 10 marks of true difference. So we will use this facility, estimation of difference within specified precision. So estimation of difference between two means with specified precision. And in this example, this specified precision is how much?
10.
Is 10. Okay, so I will click on this and now you tell me the values that I must put here. Your guesstimate of first sample mean is how much?
340.
340, that's correct.
340,
Standard deviation of first sample mean?
50.
50.
50,
Second sample mean?
365.
365.
Then
365,
50.
50.
Ratio is
50.
1. Confidence level is
65.
95.
95.
Allowable
95.
error. Allowable error is
10.
how much here?
10.
10.
10.
10, 10.
And we will calculate the sample size. And the sample size is 193 in each group. So for first objective, my required sample size is 63. For second objective, my required sample size is 193. You cannot do two studies for different objective. You are doing everything in one study in using one sample. So the actual or applicable sample size is how much? It is the bigger or lesser than 2 of these two.
Bigger one, 193.
So your
193.
applicable sample size will be 193. Okay. Now, next example. A case control study is planned to test the association between hostel stay and alcohol abuse. Previous studies have estimated the odds ratio is equal to 2.5 with exposure rate amongst alcoholics being 50%. How much sample size is needed in case and control group to test the significant association? Now here our objective is what?
To test
Whether
significance.
whether hostile stay is significantly associated with alcohol abuse by students.
Associated
This,
with
this,
alcohol
this is
abuse.
okay. This is our objective. In other words, if we are doing a case control study, I can say the same thing in different words, like whether the odds ratio is equal to 1. Am I correct or wrong? If there is no association, then our odds ratio will be how much?
1.
1. So
One.
it is one and the same. If we are testing the association, significant association between hostile stay and alcohol abuse, in some of the examples, it may be given that whether the odds ratio is significantly different than 1. One and the same. You are testing the significant association in both the scenarios. Got it?
Yes, sir.
Yes.
Yes.
Yes, sir.
So we'll go to the home page for sample size. And now, whether we are estimating in this example, whether we are estimating something in this example, yes or no?
No, sir.
Yes, sir.
No. So we'll not use any one of these. What we are doing? We are testing
Association.
testing the
Testing the
association, or
association.
whether the odds ratio is significantly different than 1, or whether the odds ratio is significant, one and the same. So here this link is given, case control or cohort studies. Sorry for this. Case control or cohort studies, and odds ratio is significantly different than 1. You got the point? Understood?
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
So I will click here, and now we'll put the give the inputs. Confidence level is how much?
95,
Power
95,
power is how much?
80,
80,
80.
Ratio of controls to
1.
cases is how
One
much?
is-
ratio
1:1.
One-sided or two-sided?
1
Two-sided.
One or two-sided?
two-sided.
Two-sided.
Two-sided. Because we
Two-sided.
don't know, it is
Ah.
not specified whether hostile stay will protect against alcohol abuse, or it is a risk factor. It is not stated here. That's why it is two-sided. Okay.
Two-sided.
Okay. And we will select any two. What is given here? In this
Odds
example,
ratio,
odds ratio is
unexposed
given and proportion of cases. Okay, these two
Cases.
things are given. So how much is the guesstimate of odds ratio?
2.5,
2.5.
2.5.
How much is the probability of exposure in cases?
50%.
50%.
50 in percentage, 50, and calculate sample size. It is 84%. Now I will ask you one question. Whenever you are conducting a case control study, there are two possible objectives. One is what we have seen. One is to estimate the odds ratio with specified precision. Understood? And the other one is to test whether that odds ratio is significantly different than 1, or whether that odds ratio is significantly different than 1 means whether there is significant association. So in a case control study, possibly we can have two different objectives. Similarly, in cohort study, also we can have possibly two different objectives. Which are these two possible different objectives in cohort study? Can you tell me, anyone?
Estimation of
Relative
relative
risk.
risk.
Yes? Huh?
Estimation
In-
of relative risk.
Yes. One possible objective can be estimation of relative risk within the specified precision. This can be one objective. And second objective can be to find it out whether that relative risk is significantly different than 1, or whether the
Significant different.
yes, very good. So these are the two possible objectives can be there. And most of the times the second objective is used whether there is significant, whether the odds ratio or relative risk is significant or not. We'll take next example. A cohort study is planned to test the association between maternal smoking and low birth weight babies. Previous studies have estimated the relative risk as 5, with incidence of low birth weight babies in smoking mothers is
You're only or you're abroad?
Can I start? Restart?
Yes, sir. Sorry, sir.
Okay.
There was
No,
something.
no. Okay. Previous studies have estimated the relative risk as 5, with incidence of LBW babies in smoking mothers is equal to 50%. That means there are two groups. One is exposed group of smoking mothers. Other one is control group non-smoking mothers. The relative risk by previous studies is 5, and by previous studies amongst the smoking mothers, 50% babies are low birth weight babies. This is the information that is given. And what is asked is how much sample size is needed in both the groups to test the association and also to correctly estimate relative risk within 20% of its true value. At 95% confidence level, 80% of power, and the ratio of cohort to control is 1:2. Now, what is asked here? How many objectives are there?
Two objectives.
Two objectives.
Which are these two objectives? First is to estimate the relative risk
Test the association.
within 20% of its true value. And second objective is to test the significance, whether these two things, means smoking status of mothers and low birth weight babies, these two things are significantly associated with each other. It also means that whether the relative risk is significantly different than one and the same. Okay. So I'll click on sample size calculation. Now for estimation of sample size for my first objective, which is correctly estimate relative risk within 20% of its true value. Which link I should use? Now here my
Relative risk.
estimation of
Estimation of
Relative
relative
risk
risk
in
in
cohort
cohort
study
study
with
with
specified
specified
precision.
precision. I'll click here and I will just put the values here. Confidence level is how much?
95,
95%.
95.
90.
Then allowable error is
20%,
20%. Control to cohort ratio
2,
2.
2. So cohort to control 1:2 means for one cohort there are two controls. So control to cohort ratio is how much?
2:1.
2:1. You did not to write is to 1. That is understood. Okay, if it is at the denominator, it is 1. You did not to write that. And here, what is given?
Relative risk,
Relative risk is given. Okay. And what is
Among
also
incidence
given?
among exposed.
exposed,
Incidence rate among exposed or non-exposed?
exposed,
Exposed.
Exposed.
Okay.
Exposed.
So, guesstimate of relative risk is how much? 5.
Hmm.
Incidence rate among exposed is how much?
50%,
50%. So sample size is 425. Now the software has given this is for second objective. Okay. Correctly estimate. Okay. Now the software has given the required sample size for cohort group as well as in control group. Can you see here?
Yes.
So why it's like that? Because our ratio is 1:2.
1:2.
Okay. You got the point?
Yes, sir.
Now, what is the other objective now? What is the other objective?
Whether there is a
the
Significant
association.
is the association.
association. So for this, I will go to case control or cohort studies here, and relative risk is
Different
significantly
than one.
different than one. One and the same?
Yes.
Clear?
Yes.
Yes, sir.
Confidence level is how much?
95,
95. Power is
80,
80.
95.
The ratio is
2.
20.
2,
2.
2,
One-sided or
Two.
two-sided? Two-sided.
2,
And what is
Two
given?
sided.
Relative risk and incident rate
exposed.
among exposed. So it is how much?
5,
Exposed.
5. Then
50.
here
50.
50. So it is 17 and 34 because it is 1:2. 17 and 34.
34.
The software also gives
34.
the sample size estimated by some other methods. EP-info uses some different formula, but this software uses the standard formula used by G-Power. And if you want to see the formula, which formula is used and the other relevant details or help, each and every page is supported with the link of its help. Can you see here formula use and other
Yes.
details?
Yes,
So
sir.
if you click here, then everything is visible. So you can just switch to the formula used and other details, and you can see, or you can study the formula. You can manually calculate. You can do anything what you want to do. Okay. So this is the example for cohort study. Now, I will request you to visit the website and do it on yourself and tell me the answer for this. Answer is actually given here. The answer is 53, but you identify which link will you use for this example, and you actually do the calculations using the software. Henceforth, you will be doing the calculations. So in this example, what is asked? Can anybody tell me what is asked here?
We want to test the significant difference in mean
That's
systolic blood pressure between
Huh?
smokers and non-smokers.
Non-smokers. That's correct. So which link will you use amongst
Estimation
this?
of
Huh? Estimation or hypothesis testing?
this is
Estimation.
hypothesis testing.
Difference.
Okay.
Hypothesis.
Difference
Hypothesis
between
testing.
huh?
Two sample means
Two dependent or independent? Just for
independence. Sir.
independent means what? What a dependent means?
Independent.
Forget at this moment. So independent means. So please calculate the sample size at your end and tell me how many of you have successfully calculated the sample size for this example. Answer is already
sir.
given there. How many of you calculated?
That's
Done, sir. 53.
Done?
Yes.
Only Muhammad is talking. Where are the others?
Done, sir.
Sir,
Done, sir.
in
Yes.
between, can I ask one question?
Yes.
Sir, you have prepared these questions, but for the any research project for sample size estimation, how to prepare such type of question? That means then we can go for selecting the which type of option should we use.
Yes, I'm not exactly getting. Means,
Asking about
will you please?
preparation of objectives, sir. How to prepare objectives.
No,
The
no, no, no. I'm
objectives
not
are,
prepared.
sir, objectives are decided by you people only. Now, what are your objectives? Means the
Sir, my
researcher will
question,
decide. Huh?
my question is that for this nine question, you have prepared this question.
Hmm.
So if I want to do a project for research project for the
Hmm.
sample size estimation, then how to prepare the such type of question?
Literature
So
search.
that means from where you will get these values you want to ask.
Literature search.
Literature search. There are two things from where you can get these values. By thorough literature search from previous studies, you can get these values, number one. Or if the studies are not at all available, if you are doing something which is very new, novel, studies are not at all available, then you can conduct a pilot
Yes.
study And from that pilot study, you can get those values.
Yes.
Thank you, sir.
Now, shall I move ahead
Yes, sir.
or next? Now, just remember, I am just explaining the sample size required for 1 or 2 objectives. For your research study, you may have 5, 6, 7 objectives. So how to determine sample size for that, we will explain in the end. We'll step by step, we will go there. Okay. At this moment, we are learning how to estimate sample size, required sample size for single objective. Okay. Now, this study is planned to test whether there is significant difference in proportion of diabetics in doctors and engineers. Previous studies have revealed the proportion as 30% and 20%. How much sample is required if confidence interval? What is asked here?
Test significant difference
Between?
between doctors and engineers on their
So between,
diabetes status.
yeah,
Between
So-
proportions.
two proportions. So which link I should use? Hypothesis testing, 2
Yes, sir.
independent samples, and significant
Two
difference
significant
between
difference between
2
two proportions.
sample proportions.
Two proportions.
Okay, you put the values here. Your guesstimate of first sample proportion, how much it is?
30%.
30.
30%.
Second sample proportion, how much it is?
20%.
20%.
20%.
Ratio,
1.
1. Confidence level,
1.
95.
95. Power,
95. 80%.
okay. One-sided or two-sided?
Two-sided.
Two-sided.
Two-sided. Significant difference is asked. If it is asked that whether doctors are more prone to diabetes, then we will use one-sided. Calculate sample size.
One-sided.
Yeah. How much is the sample size? 291 in each group. Understood? Shall I move ahead?
Yes, sir.
Yes,
Sir,
sir.
one doubt, sir.
Yeah.
So,
Please.
shall we put this ratio of sample size in two groups every time as 1, or is there any
No,
changes
it's
required
depend
according
on,
to?
it depends on your objective. It depends on your availability of persons in each group. The investigator is free to choose the ratio of persons in these two groups.
Okay.
1 or 2 or 3 or 4, not more than 4. So it's up to you, depending on the
Okay.
availability and depending on other things. Means the availability of persons also and availability of your resources also. So depending on that, you can choose, but it's your discretion. There is no such concrete principle to have how much should be the ratio.
Right.
Okay.
Thank you, sir.
Okay.
Excuse me, sir.
Yeah. Please. Please go ahead.
So may I ask one doubt that if research have does the researcher have a choice that allowable error can be also chosen by themselves, like, or is there any criteria?
No, there is no such criteria. But if allowable error is too much, your purpose will be defeated. If you want to extrapolate the results, or if you want to take decision based on your findings of your study, based on the findings of your study, we'll want the results of the study to be precise. If the allowable error is too much, you may have results like the proportion of smokers sometimes means between 20 to 80%. So it will have no meaning. Your resources will be lost. So you will have to find out golden mean between available resources and the results. Of course, it's your discretion to choose the allowable error. That is perfect. But you should choose allowable error in such a way that you can use the findings of your research study to take some decisions. And
Thank you,
around
sir.
10, around 10% is the universally accepted. But that doesn't mean that it should be 10%. You can have more than that also depending on the situation. But there is no such criteria. Shall I move ahead? Yeah. Now, this is something which is different than what we have studied. Now, till in first 10 examples, we have seen the estimation of mean, estimation of proportion, estimation of difference or significance testing between two means, two proportions, etc., etc. Now, in this example, the objective is to find whether there is significant difference between three means. Which test will you apply here? Anybody?
One way ANOVA.
One way ANOVA. That's correct. ANOVA. ANOVA test will you use, and how to calculate the sample size if your objective is to test the significant difference between more than two means where you intend to apply ANOVA. For this, go to the home page, and which link should I use? Again, it is hypothesis testing. It is not estimation of something. We are testing the significant difference between more than two means. So, which link should I use?
Significant difference between more than two sample means.
Hypothesis testing
Sample
more than
means.
two
More than two
independent
independent.
sample. Yeah. So,
Hmm.
significant difference between more than two sample
Two
means.
sample
means.
So, I will click here, and now I am diverted here. Can you see this?
Yes, sir.
Yes, sir.
So,
Yes, sir.
how many groups are there?
3.
3 groups.
3 groups. So, I'll put 3. Automatically, 3 rows are seen, and each row corresponds to the guesstimate of mean and SD in each group. So, how much is the guess of mean in first group? How much is that? It is given
126.
126. Standard deviation is how much?
20.
20. And sample size ratio. Now here, 1 is taken as the baseline for the group which is having minimum sample size. Now, if equal sample size in these 3 groups, means ratio will be 1:1:1. That's
Yes.
correct?
Yes, sir.
So for each group, it will be 1, 1
Yes.
and 1. If you intend to have double the sample in second group only, then we will put 1:2:1 like this. Understood?
Yes, sir.
Yes, sir.
Okay, but in this example, the ratio is 1:1:1 because equal sample size is there in these 3 groups. So 126 plus minus 20. The next is how much?
136.
136 plus minus
30.
30.
30.
Then next
30.
is how much?
140. 30.
140.
140 plus minus
40.
30. 30. Okay.
30.
Next is confidence level is 95.
95.
Power is
80.
80.
80%.
Okay. So the sample size is 69 in
69
first
in each
group. In first group. It means you must have the sample size equal to 69 in first group, equal to 69 in second group, and also equal to 69 in third group. Okay, you can, yeah. Clear? Now I request you to
Yes.
calculate the sample size for this example. Example number 12. You calculate the required sample size for this and tell me the answer. Finished? How much is the sample size? Can anyone tell me?
21 in each group.
Hmm?
21 in each group.
21. Please recheck. Slide gettings. Others? How much is the sample size?
24, sir.
Ah,
24.
24, sir.
24. 24 is the correct answer. 24 in each group. Okay. Shall I move ahead? 24
Yes,
in
sir.
each group. Okay. Am I going fast?
No, sir.
Okay. Now, only few examples we'll see. Now, in this example, a study is planned to find association between BMI having three categories. It's a categorical variable having three levels such as normal, BMI, overweight, and obese. These are the three categories. And we want to find the association between BMI and hypertensive status. A pilot study has given following results. A pilot study is conducted in which 30 persons from each level, from each of these three BMI levels, normal, overweight, and obese, were selected, and it was determined how many of them are hypertensive and how many are
Sir,
normal.
I
Yeah.
have doubt in one previous example. There
Okay.
are four groups. So how to go with that fourth group, sir? Three
Means
columns are showing there.
no. You number of groups in the first here. See.
Okay.
So how many number of groups are there?
Four.
Four. So instead of three, you put four. Okay. What I have? Can you see there?
Coming only three.
Three only, sir. Only three groups are coming, sir.
No. These are four groups.
So,
See.
so we have
On
to put
mobile, there is
enter.
Internet.
Internet issue
Okay.
may be there, but can you see here how many groups are there?
4.
Now it's
Please see on your screen how many groups are there?
Four.
Four. If I put 6, how many groups are there now?
okay.
Now I have put how much?
Six are there, sir. Six are there.
Okay. Thank you.
Thank you, sir.
It's clear. So you
Yes,
have to
sir.
put the number of groups in your study here, and those many number of rows will be visible here. Okay.
Okay, later on. Let's see.
Shall I move ahead?
Yes, sir.
Now, next is, now here which test will you apply? Just looking at this data, which test will you apply to find the association between BMI and hypertension?
Chi-square.
Chi-square test. Very good. So chi-square test is applied here to find the association between these two variables, BMI and hypertensive status, and to calculate the required sample size based on the findings of this pilot study or based on the findings of any previous study. You can calculate the required sample size for your study. How? I will just explain. Now here hypothesis testing. Now here what we are doing? We are comparing the proportions here. 33%, 33.33% are hypertensive within normal BMI group. 50% persons who are overweight are hypertensive, and 66% persons who are obese are hypertensive. So we are comparing just these three proportions. That's why we will select what? Hypothesis testing, more than two independent samples. These are more than two independent samples. And chi-square test of independence. Can you see here?
Right,
sir.
yes, sir.
Okay. Significant difference between more than two sample proportions or chi-square test of independence.
Independent.
Okay. So I will click on this link. Now, how many groups or rows are in your study? How many
Three.
rows are there? 3 rows.
3.
3. So okay. How many columns are there in your study?
2.
2 columns.
2 columns are there. So I'm putting 2. So automatically 3 rows and 2 columns are visible here. And just you will have to put the data in these columns. And you have to put the percentages.
Yes.
Okay, proportions, because actually you are comparing the proportions. Even if the test is applied on actual values, here you are comparing the proportions. So here you should put how much? 33.33.
3.
Here, how much it is? 66.67.
66.67.
Here, how much is? 50
50.
and 50. Here, 66.67. Then 33.33.
3.
And confidence level is how much?
95.
Power
80.
80.
And sample size is 40 in each
40 in
group.
each.
Okay, so this is the required sample size.
So,
Now this is for chi-square test for goodness of fit. I will skip this. Or you want that chi-square test for goodness of fit? You can practice it afterwards. Okay, time is very less. That's why. Now the real stuff. Till this moment, we have seen how to calculate sample size for one objective. But in reality, whenever we are conducting any research or doing any thesis, the sample size, the objectives are never, the objective is never one. There are multiple objectives. Or even if it is a case control study, then you can test the association between multiple risk factors with the disease under investigation. So for example, if you want to do a case control study to identify significant risk factors for CA colon, the investigator can explore the following multiple risk factors, and this is the actual scenario, practical scenario, in which a case control study will explore the association of multiple risk factors with the disease. This is the real scenario. So in this situation, suppose this is a thesis topic, case control study to identify significant risk factors for CA colon amongst dash, 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 dash. So in this scenario, how will you calculate the required sample size? So in this scenario, we'll have to enumerate the possible risk factors that you are studying in, in your research. So I have just enumerated 4 possible risk factors. There may be many possible risk factors you are going to explore in your case control study. And these 4 possible risk factors are non-veg diet, whether non-vegetarian diet is associated with CA colon, whether acid peptic disease is associated with CA colon, whether obesity is associated with CA colon, whether alcohol consumption is associated with CA colon. Similarly, you can have n number of risk factors tested in your case control study. Understood?
Yes, sir.
Now, for this case control study, how much is the sample size required? Now, what will you do now? You will go do the review, and you will have to find out the odds ratio for each one of these possible risk factors provided by previous studies. And based on this previous data, you will have to calculate the sample size required for testing each one of these risk factors. And then you will have to take the maximum of that sample size. For example, there are 4 possible risk factors. You can have 8, you can have 10, you can have n number of possible risk factors. But here, for example, I have given 4 risk factors. These are the 4 risk factors, and these are the possible risk factors. And after doing review of literature, I have found out these things. For non-veg diet, the odds ratio reported is 2.5 with exposure rate amongst cases equal to 10. For acid peptic disease, the reported odds ratio is 2 with exposure rate amongst cases 20, and so on. And based on this data, I have calculated the sample size for each one of these risk factors. Understood?
Yes, sir.
Understood?
Yes,
Okay.
sir.
Yes,
Yes.
sir.
So what you should do whenever anyone is conducting a case control study, then you will have to identify possible risk factors, and based on those possible risk factors and review of literature, you will have to find out how much is the reported odds ratio for these risk factors, how much is the exposure rate amongst cases for each one of these risk factors, calculate the sample size, and get or identify the sample size equal to maximum of this. Okay. Now I request you to use this, go to the website and calculate the sample size required for each one of these risk factors. Your answer should match what I have provided here. Please do it fast within 2 minutes. Please complete this exercise.
Sir, I have a doubt here, sir. Sorry for
Yes.
interrupting.
Yes.
Sometimes we might not get, we know there are possible risk factors for a particular thing, but we might not be getting all the odds ratio and values because some studies would have evaluated some risk factor, other studies would have evaluated some other risk factors. But we want to evaluate all the possible risk factors. So, for in that scenario, how to go about it, sir?
Yes, that's a very good question. You can use multiple studies, and you can, using multiple studies, you can use the odds ratio reported by each one of these two is to calculate the required sample size for that respect. So if there are 10 studies available and those 10 studies has reported different 20 risk factors, you can use those studies.
Okay.
If at all nothing is available, if you think that such a risk factor is there, no one has thought of that risk factor, and no one have explored that association in the past.
Yes, sir.
In that scenario, either you can go for the pilot study, or this is important, what you can do, excluding that risk factor for which the data is not available, you can calculate the sample size, and then in your study apply the test for that risk factor also, for which the previous data is not available, and report the power.
Yes, sir. Okay, sir. Got
Report
it,
the
sir.
power.
Yes.
Okay.
Yes.
So sample size was not estimated for this risk factor because of unavailability of the previous studies. But after doing power analysis, the power is this much. Okay. So this is the option that you can go with.
Yes. Thank you, sir.
Yeah. Please calculate the sample size required for each one of these risk factors. Done. How many of you completed this? Please let me know when you have finished it.
That's
Completed?
sir.
Yes, sir.
Yes, sir. Done, sir.
Okay. Shall I move ahead? Now, this is the practical situation wherein you will have to calculate the sample size for multiple objectives. Now, next example. Now, this is also one of the practical situation where there are multiple objectives. A study is planned to estimate proportion of low birth weight babies within 10% of its true value. Means we want to estimate how much is the proportion of LBW babies within 10% of its true value, and also to identify significant risk factors for low birth weight babies. Investigator wants to explore following possible risk factors. Again, I have given only 4 possible risk factors. You can have hundreds of possible risk factors for low birth weight babies, and you can explore the the association of that risk factor with low birth weight baby. Just for the sake of example, I have given only 4 risk factors. Now, how much sample size is required to find the significant association at confidence level of 95%, power 80%, and equal number of cases and controls? Review has given following information. The first information from review is the guesstimate or guess of LBW proportion is 25%, which is required to calculate the required sample size for estimating of the proportion. And for each one of these, each one of the possible risk factors, the odds ratio and exposure rate amongst control is given. Now, please use this information and calculate the sample size for both of these objectives. Number one, for estimation of proportion within 10% of the true value, and identification of risk factors or significant risk factors. Have you started? Please let me know whether you have started calculating it.
Yes, sir.
Okay.
Yes, sir.
Now, I think everyone should be able to calculate the sample size required for estimation of LBW baby proportion, which is equal to 73. How many of you have calculated it correctly? Please respond. How many of you calculated the sample size correctly for first objective? Nobody?
Yes, sir. Correctly estimated.
Okay. Anybody
sir.
else?
Yes, sir.
Okay.
Done.
It's quite simple. Okay. First is estimation of proportion within 10% of its true value. So sample size required is 73. And for 4 of these possible risk factors, 3 are categorical. That's why odds ratio is given. 1 is in ratio scale or numerical. That's why mean is given. So for first 3 categorical risk factors, You can use the link for odds ratio, and for next mean age in cases versus mean, sorry for that spelling mistake, that is not mean age. For the mean age in controls, you can use the link for difference between two means.
2 means.
So you will have 5 different sample sizes. Correct? One sample size for first objective and 4 different sample sizes for 4 of the risk factors.
Yes, sir.
Sir, last one I
Which
didn't
one?
get this
Yes,
mean age in
last
cases.
one complete.
Now, see.
What was the question, sir?
Investigator wants to explore possible risk factors. Means in primary, how much is the proportion of low birth weight babies? Okay. As compared with non-primaries. Second risk factor is preeclampsia, proportion of LBW babies for preeclampsia woman versus normotensive. Maternal smoking, yes or no, and maternal age. Means the mean maternal age for LBW babies versus mean maternal age for normal weight babies. So this is one, maternal age is one possible risk factor, and to identify whether maternal age is a possible risk factor, you will compare the mean maternal ages in these two groups, LBW baby group and normal weight baby group.
Yes, got it.
Okay. Have you calculated this?
Yes, sir.
Yes, sir.
Everything is correct?
Yes, sir.
Yes.
So how much is the sample size, actual sample size for your study? How much is the actual sample size?
383
383
last
in
one.
each group.
383.
Now 383 in each group. The sample size is 383 for LBW group as well as 383 in normal weight group. Isn't it? Because now just use your common sense. For second objective, this is a case control study.
Yes,
with
sir.
ratio of cases and controls 1:1. And if sample size is 383, that means you must have 383
383 on each group.
low birth weight babies. Understood this?
Yes, sir.
Yes, sir.
Everybody understood this?
Yes, sir.
Yes, sir.
You must have how many minimum low birth weight babies?
383.
383.
383. Now, to have 383 minimum low birth weight babies in your study, how many total mothers must be included? Use your common sense. Because if you include 100 mothers, you will get only 25 low birth weight babies. Because guesstimate of LBW proportion is how much? Are you getting what I am
25.
trying to convey?
Yes, sir.
Now, just I'm again repeating from scratch. With this, you are having
1600.
you have calculated 5 different sample sizes. One is 73 for
Yes, sir.
estimation of proportion. Other one is 383 and 383 in case group and control group. This is second sample size. Third sample size is 99 and 99. Fourth sample size is 203 and 203. And last sample size is 9 and 9. Up to this, it is clear?
Yes, sir.
Everyone?
Yes,
Yes,
sir.
sir.
Okay. Now, which one will you choose now amongst this? Highest one. Highest one is which one?
383.
383. So you must have 383 and 383 in your study. Okay. Now, your first objective is to, this is the first objective, estimate proportion of low birth weight babies. That means you are selecting all the mothers that are available. Okay. Now, if you select 100 mothers, how many LBW babies you will get?
25.
25%.
25. Okay.
25. 25.
Correct. If you include 200 mothers in your study, how many LBW babies will you get?
50.
50.
50.
50%.
If you include one, if
Oh,
not 50%, 50.
it is 25%.
It is
50.
25%. So if you include 200, so you will get how many? If you
50.
include 100, you will,
50.
yes. If you include 1000 mothers, how many low birth weight babies will you get? If you include
250.
1000 mothers,
250.
250.
250.
Correct?
250.
If you include 2000 mothers, how many LBW babies will you get?
500.
500. How many low birth weight babies you want? Minimum
383.
383. So your sample size will be, actual sample size of all the mothers will be
1532.
around between,
1532.
32.
so it will be,
1532.
yes, 1532. You got it?
Yes, sir.
Yes, sir.
So to have 383 low birth weight babies at possible proportion of 25% and to have minimum 383 cases, you must include 1532 mothers. You can add more mothers to means compensate for loss or the change in some proportion, but minimum 1532 mothers must be included so that you can have at least 383 cases in your study. Okay. Understood?
Yes, sir.
Huh? Everybody?
Yes, sir. Yes, sir.
Yes, sir. Yes, sir.
But if you think this is too much, it is not feasible, what will you do? What will you do to reduce the required sample size without affecting your power, without affecting your confidence interval? What will you do?
Ratio will.
Yes,
Or
that's
control.
correct. So instead of taking 1:1, because see, as the proportion is 25% of low birth weight babies, for every low birth weight baby, you will have 3 normal weight babies. Understood?
Yes.
Because out of 100, 25 will be low birth weight babies and remaining 75 will be normal birth weight babies. So maximally you can have 1:3 ratio, and using that 1:3 ratio, you can revise the sample size, and based on that revised sample size, you can calculate or estimate the reduced sample size. Please go ahead and do it. Use the 1:3 ratio only for a primary you calculate, because that will be that is the risk factor which is giving highest number of highest sample size. And now how much sample size is required?
Two 41, sir. 41.
240. Everybody agrees? I have not calculated. I don't know what is the exact answer. So everybody agrees to this?
Yes,
Everybody
sir.
agree to this?
Yes, sir.
Okay. And it is the
241
241 cases. 241 is the sample size. For primary. Okay.
Yes, sir.
And how many controls? 1 is to
723.
3. So total
7.
sample size? So total sample size is?
Nine 64.
64.
Okay.
964.
I don't know the exact answer. If everybody agree to this, I will move ahead. This is the real, actual, practical example I'm taking.
Yes, sir. 964.
Okay. Everybody understood this? Okay. Shall I move ahead?
Yes, sir.
Yes, sir.
Yes, sir.
Okay. Thank you. So, in summary, to calculate the required sample size for your research, you will never have one study objective. So we'll have to enlist all the study objectives, identify whether these objectives, they intend to estimate something or they intend to test or apply any test. And for each of the objective, identify the information required for those study objectives. You need not to remember what information is required for each of the study objectives. You can visit any any website, any software, and based on what is there in front of you, you can gather the information required for calculation of sample size related to that study objective. Find the sample size required for each of these objectives, and finally select such a sample size which will be sufficient for all your study objectives. So this is about the descriptive study, case control study, or cohort study. Any queries up to this? Now just within few minutes I will complete the clinical trials. Next part. But up to this, if you are having any query, you can ask me. In chat, there is one query, I think. For ANOVA, how 1 is to 2 is to 1 is to be put. Okay, this is the query. Who has put this query?
Shweta.
Okay. Huh. Is it Shweta? Okay. What exactly you want to ask, Shweta madam? Okay. I think when she is available, we'll discuss on that. Any
I
other
think
queries on this? Huh?
when this condition is required to use 1 to 1.
No, sir, it depends on your availability. Means suppose if there are 4 ethnic groups in which you want to estimate the mean birth weights in those 4 ethnic groups, depending on the
Okay.
availability, if group 2 is means the availability within group 2 is more than what is available in group 1, so you can choose that 1 is to 2 is to, or 1 is to 2.5 is to 2 is to 3, whatever, means depending on the availability.
Okay.
Good evening, sir. Am I
Yeah,
audible, sir?
yeah, you are audible.
So
Yeah,
I'm Dr. Shweta. So I
yeah.
basically asked about like one example you have shown on the screen.
Hmm.
So
Okay.
in that you mentioned about like in every example you were taking like 1 1 1 in the last
Okay.
last column. But in one example you explained about 1 is to 2 is to 1, which I couldn't hear. So
Okay. Okay. Now, this is in ANOVA, because 1 is to 2 is to 1. That means there are more than 2 groups. That means the applicable test here is ANOVA. Am I correct?
yes, sir.
Okay. Now,
Yes.
this is the example I'm showing here. Here, there are 1, 2, 3, and 4 different groups, ethnic groups, and we want to compare the mean heights in those 4 ethnic groups. Now, suppose this is ethnic group A, ethnic group B, ethnic group C, and ethnic group D. There are 4 different groups. Now,
Yes.
suppose in your population, ethnic group A, the total number of available people are quite less as compared with ethnic group B. So what will you do? You will select less number of people from group A and more number of people from group B because they are more available. And in group A, there are less available. So you can have the ratio for group 1 to group 2 as 1:2. Means if there are 10% selected from group A, you can select 20% from group B. And if the ratio is 1:2:1:1, that means 10% from group 1, group A, 20% from group B, and again 10 and 10% from group C and D. And if this is the situation, how to use this information to calculate the sample size, I will demonstrate here. There are 4 groups here. 4 rows are available now. So for first group, the mean is how much? 165. Standard deviation is 10 and sample size is 1. Ratio is 1. It's the ratio 1 is then next is 168, 10, and now more number of people are available from this group. So I will take twice the number of people in this group as compared with other groups. So ratio will be 2 here. Okay, then 175 and 11, I will include the equal number of persons in this group equal to group 1. So ratio is 1 and 169 plus minus 11, ratio is also 1. So that means now 1:2, 1:1. This means that if there are 100 persons in group 1, there will be 200 persons in group 2, 100 persons in group 3, and 100 persons in group 3. Simple. If this is 1.5, this means that if there are 100 persons in group 1, there will be 200 persons in group 2, 150 persons in group 3, and 100 persons in group 4. That's all. Understood?
Thank you so much. Yes, sir. Thank you so much, sir.
Got it.
Okay.
Sir, sorry to interrupt. I have one request. If once you demonstrate that peptic ulcer wala example.
Yeah, this one?
Yes, sir.
This one?
Yes, sir.
Okay. Now, this is a case control study. And in this case control study, possible risk factors are only 4. We have identified, or the investigator intends to explore whether these 4 risk factors are significantly associated with CA colon or not. And the previous study has given these findings. Okay. So for non-vegetarian diet, the odds ratio is 2.5 with exposure rate 10. Acid peptic disease, the odds ratio is 2 and exposure rate among cases is 20. So for each one of these risk factors, I will calculate the sample size. For that, I will use which utility? Here, I want to just test whether these risk factors are significant or not. So which link I should use? I do not want to estimate exactly the odds ratio. I want to
Odds
estimate.
ratio is
Yes. Which one? That's
odds
correct. Which
ratio
one?
is significantly different than 1.
Okay, that's correct. So I will click here and I will calculate the required sample size for each one of these risk factors. So for acid peptic disease, the odds ratio is how much? First, I will put these values. Confidence level of 95%, power of 80, ratio of cases to controls is 1. It is two-sided. And odds ratio is given. And exposure rate is given. So for acid peptic disease, 2 and 20. Odds ratio is 2. Exposure rate among cases is 20. So sample size is 268. Similarly, I can calculate the required sample size related to each one of these risk factors, and I will select final sample size equal to which is the maximum one. Understood?
Yes, sir.
Clear?
Thank you. Yes,
Okay.
sir.
So last, I think the time is over. Can I continue or we have to stop at 8 o'clock?
No, sir, we can
Continue, sir,
continue,
please.
sir.
Continue, sir.
Continue.
No problem?
No
Okay.
problems.
Okay. Now, we have seen the sample size required for descriptive studies where we are estimating something. Analytical studies where we are comparing two groups or more than two groups with each other. And now we'll see how to calculate the sample size for clinical trials. Now, clinical trials can be of three types. It can be superiority design, it can be non-inferiority design, and it can be equivalence design. And what happens most of the times, what type of clinical trial is that is not mentioned. I'll request each one of you to mention it. And if it is not mentioned, it is implied that it's a superiority type of design in which the test drug, it is tested that whether the test drug or test treatment is superior to which one is already in existence or placebo by a superiority margin. I will explain what do you mean by this? What do you mean by superiority design? So first I will explain what is superiority design. In superiority design, a new treatment is tested for superiority with the available treatment, and that too by a superiority margin. That means, suppose the success rate with a known treatment is 50% and superiority margin is considered as 10. Then I will call treatment A superior only and only if treatment A is giving success rate more than 50 plus that superiority margin of 10 more than 60. So I will explain here what is this. Suppose there is drug B, which is a comparison drug, which is already in existence. Understood what I'm trying to tell? This drug B is already in existence and the mean reduction in systolic blood pressure by drug B is 40 mm of Hg. Understood up to this? Please
Yes,
reply.
sir. Yes, sir.
Yes, sir.
Okay.
Yes, sir.
Now,
Yes, sir.
we want to test drug A, which is our test drug. This drug B is known drug. So we want to test drug A for its superiority over drug B. And superiority margin is considered as 10. Then superiority is said only if the reduction in systolic blood pressure by our test drug is more than the margin of this over this. Means if it is more than reduction in systolic blood pressure is more than 50 with drug A. If the reduction in systolic blood pressure is only 45, with drug B it is 40, with drug A it is 45. So the difference is within the superiority margin. So I will not say drug A is superior to drug B. I will say drug A is superior to drug B only if this reduction exceeds the margin of superiority. Understood?
Yes, sir.
Yes,
Everybody?
Yes, sir.
Yes, sir.
So
Yes, sir.
40 versus 51 superior. 40 versus 49. Even if 49 is more, not superior. Understood?
Yes, sir.
Yes, sir.
So if superiority margin is 5, suppose in this example, if superiority margin is 5, then to say that drug A is superior to drug B, how much must be the reduction by drug A in systolic blood pressure? If margin is 5, how much?
45, sir.
More than
45.
More than
45.
45.
Correct? So superiority margin is nothing but a margin which has some clinical meaning. Means suppose a drug A is giving reduction by 40. Drug B, which is known drug, is giving reduction by 40. And new drug is giving reduction by 45. This difference of 5 is that much, not clinically important. That's why in that scenario, we will not say drug A is superior. Only if margin is more than 10, which is clinically relevant margin, then only we will say drug A as superior. So in clinical trials of superiority type of design, superiority is defined by superiority margin. Understood?
Yes, sir.
Other type of clinical trial is non-inferiority design. Suppose drug A is a new drug and we want to introduce it in place of drug B. Drug B is reducing the blood pressure by 40. But it is having some complications, some side effects. Our cost is very high. There is drug A, new test drug, which is not as effective as the known drug, but it is having less cost or less side effects. And as good as, we can say, as good as the drug B, or at least not inferior to drug B by that margin. Understood what I'm saying?
Yes, sir.
So,
Yes, sir.
if drug B is giving the reduction by 40 and drug A is giving the reduction by only 25, difference is 15, more than that margin, then I will say no, drug A is inferior. But if the reduction in blood pressure with drug A is within 10 or that clinically acceptable margin, then I will say that it is not inferior. Understood? Understood?
Yes, sir.
Yes, sir.
Yes,
Yes.
sir.
So superiority design is adopted where you want to prove that one drug is superior in efficacy than other drug or the existing drug. Non-inferiority design is adopted when you want to prove that the new drug or test drug is at least non-inferior to the existing drug and it gives results within some margin, maybe below the available drug, but within some margin nearer to that efficacy. But that new drug is having either less cost or less side effects or more easily available, whatever it may be, other benefits are there. So you want to test whether drug A can also be introduced. And equivalence design is just the new drug is equivalent. In non-inferiority design, what we are doing, it is not inferior. It may be superior, we don't know. But in equivalence design, it is equivalent. Means if the margin is 10, the new drug will have its effect between 30 and 40. 10 here, 10 there, within the margin. If it is less than 10, it will be less than 30, it will be inferior. It is more than 50, it will be superior. And if it is in between 30 and 50, it will be equivalent. So these are the three main types of clinical trials, and you will have to learn to calculate the sample size for all these three types of clinical trials. Similarly, if the data is binomial, success rate, in terms of success rate, here the data is ratio. The same concept is here. If drug B or known drug is giving success rate of 75% and superiority margin is 5%, then drug A or new drug will be called as superior if and only if its success rate is more than 75%. Drug A will be called non-inferior if and only if its success rate is more than 65%. And it will be called equivalent if it is 5% here and 5% here, 65% to 75%. I think I'm clear in this. All of you understood
Yes,
what do we mean
Yes,
by
sir.
superiority,
Yes, yes.
non-inferiority,
Yes,
and
sir.
equivalence design?
Yes, sir.
Yes.
Very, very clear. Okay. Now,
Clear, sir.
huh?
Clear, sir. Clear.
Okay, thank you. Next, now we'll calculate the sample size required for each one of this design. Okay, now this is one example. Mean reduction in systolic blood pressure with a known antihypertensive drug is 40 plus minus 6. So it is mean reduction with a known. So it is whether it is test drug or known drug. Known antihypertensive drug.
Non-drug.
Reduction is 40 plus minus 6, known drug. A new antihypertensive drug is to be tested for superiority as compared with this known drug. The mean reduction with this test drug is expected to be 60 plus minus 6 mm of Hg based on previous reports or by pilot study. How much sample size shall be required if superiority margin is decided as 8 mm of Hg? So what does it mean? Superiority margin of 8 mm of Hg. It means that the known drug,
40.
yes, only and only if the new drug is giving values more than 48.
Plus
Correct?
48.
48. Okay. Correct? So we'll calculate the sample size required in this. So I'll click on sample size calculation, clinical trial superiority design, and outcome variable. Outcome variable is ratio scale or nominal scale? Numerical means ratio scale.
Ratio.
In percentage.
Ratio.
Okay. Now you have to just put the values. Mean in test arm is how much? Test arm.
40.
Huh? Test arm. Not known drug.
60.
Test drug.
60.
60.
60. Standard deviation?
6.
6. Control arm means which is known?
No.
40.
That is 40.
40. Standard deviation?
6.
6. Ratio of sample sizes?
1.
1. Confidence level?
90.
95. Power?
80%.
Superiority margin. How much?
8.
8. Always it is a one-sided test. Why it is one-sided?
We are
Because
testing.
yes,
Whether
whether it is one-sided.
one
drug is superior than other.
Yes. Okay. So that's why it is always 1. So calculate sample size. The sample size is only
4.
only 4. Yeah, something. Okay. Huh? Superiority margin is 8. Okay. Huh? So you have to calculate the sample size like this. Now you calculate the sample size for this. Okay. Success drug of known drug is 75%. A new drug is to be tested for superiority. With this, you please use this example and calculate the sample size. Which link will you use?
Nominal, sir.
Yes, and calculate the sample size.
So one small doubt, sir.
Yes.
So this D value, by the use of literature research only, we will decide on this margin.
No, sir. There are few things to take into consideration while deciding the superiority margin. The superiority margin is usually decided by the clinically relevant margin.
Okay, sir.
So if it is a reduction in blood pressure, how much reduction the clinician considers as clinically relevant?
Okay.
So reduction by 10 mm of Hg. So it is the decision based on the experience of the researcher and based on the minimum reduction or the reduction he wants, which will have the clinical change in the patients.
Okay, sir.
Yeah. So
thank you, sir.
yeah. Use this and calculate the sample size.
172, sir.
172.
Correct?
Yes.
172.
Okay. Yeah. Next example. Mean reduction in systolic blood pressure with known antihypertensive drug is 40. For non-inferiority. And please read what is given in the next column. Details are given in the next column, which will help you in understanding the output. Which link will you use?
Outcome variable
Inferior,
ratio, non-inferiority.
This
Non-inferiority
one.
design.
This one. Okay. What is your answer? What is your answer?
50. 50.
50.
50, sir. 50.
So mean in test arm is how much? Test
35.
arm it is 35. Okay. Standard deviation is 6.
6.
Control arm it is 40.
40.
Standard deviation is 6.
6.
Now you can compare. The test drug is 35 and known drug is 40. Okay, control arm. Known drug is 40. So apparently the test drug is inferior, giving somewhat less values. Okay.
Yes.
But whether this difference is within the margin, that that we are testing, and for that we are calculating the sample size. So 1 is the ratio. Confidence level is 85, 80. Non-inferiority margin is how much? 8.
8.
And again, one-sided test only.
Hmm.
50 and 50. And please read here. Based on the approximate estimate of mean of test arm 35, mean of control arm 40, non-inferiority margin of 8, implying that non-inferiority shall be assumed if test arm mean is not less than 35. Okay, clear?
Yes, sir.
Confidence level of 95, power 80, one-tailed hypothesis. The required sample size is this much. Okay. Please calculate for this example.
$984.
$984.
Everybody, it is clear?
Yes, sir.
Shall I move ahead? Okay. Now solve for this example.
$69.
69, sir.
Okay. Next. This is
457.
417.
Okay. So you understood what is superiority design, non-inferiority design, equivalence design, and how to calculate sample size for each one of these.
Yes,
Okay.
sir.
Yes, sir.
Okay.
Yes, sir.
Now we'll just take some exercises, 2 or 3 exercises, and we'll stop. You calculate the sample. Now, I think I should skip this. It's very easy. Find the prevalence of dental caries in school-going children with 5% of its true value. It's very easy, I think. You should be able to calculate this now.
Hmm.
How much is the answer? This is the answer, 323. Now,
Hmm.
this is exercise 2 for you people. A case control study is planned to identify risk factors for dental caries and the possible risk factors like no regular brushing or heredity or consumption of sugar. These are the 3 risk factors for the sake of example I have taken. And the information available is in front of you. Calculate the required sample size. Here only the objective is to identify the significant risk factors, no prevalence. So what will you do? What will you do here?
We will find the sample size for each.
Yes.
Hypothesis test for odds.
Please tell me how much is the sample size for each one of these 3 risk factors and how much will you select?
Sir, irregular brushing 262.
Now, for this example, I forgot to tell you, take alpha as or confidence level as 95, alpha as 5, confidence level of 95, beta, the power as 80, and ratio as 1:1. For all the examples henceforth, 2-3 examples are there. Take this.
For irregular brushing, it's 262.
Everybody agrees to this? I don't know. I have just put this
Yes, sir.
example. How much
Sir,
it
is
is?
it 107?
62.
How
Sir,
many of are
irregular.
in favor of 107? 3 versus 10.
Sir,
I think it must
107.
be around 100. It must be.
Sir, 107.
Okay. 107 may be correct. More correct. Okay.
I
Okay.
think they might have taken proportion of cases exposed, but here they have given proportion
Now
of
see,
The
exposed.
controls are not
exposure
cases.
amongst controls.
Yes, sir.
It's not
Sir.
exposure amongst cases. Because that study has reported like that. That's why this data is available. It's not exposure among cases.
107.
How much it is? All of you agree with 107?
Yes.
Yes.
Okay.
Yes,
For
sir.
second? For second?
240.
Okay. For third?
47.
Okay. So how much is the applicable sample size in each group?
240.
240 is the minimum sample size in each group. So total sample size will be 240 plus 240. Okay. Shall I move ahead? Now, your study is a cross-sectional study. And in this study, you want to find out how much is the prevalence of diabetes within 10% of true value in the population. And in that cross-sectional study, you will have some diabetics, you will have some non-diabetic persons, and you will compare the proportions of obesity as well as sedentary lifestyle, as well as heredity within these 2 groups. Inbuilt these 2 groups, diabetic and non-diabetic group. and information available is the guesstimate of prevalence is 18%, prevalence of diabetes is 18%, obesity in diabetics and non-diabetics is 30% versus 20%, heredity is 28% versus 15%, and for sedentary lifestyle data is not available. Suppose, how will you proceed? What will you do? Anybody?
First of all, estimate the proportion, then estimate
Okay.
for the risk factor.
How much is the sample size required for estimation of proportion? Fast.
57.
Yeah, that's correct. Okay. Next. Now to test whether there is significant difference between proportion of obese in diabetes and non-diabetics. The data given is 30% and 20%. Again, I'm telling you confidence interval of 85, confidence interval of 95, power of 80, and ratio of 1.
$291, sir.
Okay. Others, whether they agree with this 291?
Yes, sir. For obesity and diabetic,
291. All of you agree? And then for heredity, how much is the sample size?
153.
153, sir.
Okay. Now 57, 291, 153 is the sample size, 3 sample sizes, and 10% the available. Using all this information, how much will be your final sample size?
290.
291 diabetic persons you want. Okay. Because you want 291 diabetics as well as 291 non-diabetics in your study. Isn't it? Understood, everybody? So to have 291 diabetics at 18% of prevalence, how much must be the sample size? Just use your common sense. If you select 100 persons, you will get 18 diabetics. If you select 200 persons, you will get 36 diabetics. You select 1000 persons, you will get 180 diabetics. So to have 291 diabetics, how much sample size is required?
970.
Pardon?
970. 970, sir.
No, I don't know. I have not calculated. If everyone agrees, that may be correct. How will you calculate that?
16.
Out, out, out of 100,
I think
there are
it must be more than 1,500, around 1,600.
1616.
Yeah, that may be correct at 1616. So for
1,000.
1,000 people, you will get 180 diabetics. You want 291 diabetics. So it must be
yes,
more
sir.
than 1,000. Just I will calculate. It's 1600 and 16 point somewhere, 1617 or 1616. Everybody,
Yes, sir.
have you calculated that?
Yes, sir.
Yes, sir.
No, this is just 7th standard mathematics. It means I don't think any software is needed for this. Clear? It's
Yes,
very
sir.
simple. For 1,000 people, you will get 180 diabetics. For 291, how much will you need? So it is 1616, around that. Okay. Now, for sedentary lifestyle, the data is not available. So what will you do? You will prepare a table in your final thesis for sedentary lifestyle, and in the discussion, you will write that the sample size was not estimated considering the sedentary lifestyle because of the non-availability of the previous data. However, we have calculated the power, and power is this much. Okay.
Sir, I have a question.
Yeah.
Sir,
Please.
can we make a guess estimate of or sedentary lifestyle literature is available or no data?
Extremely sorry, madam. Your voice breaks, so I couldn't hear what you clearly said. Please, will you please repeat it?
Sir, in case of proportion,
You please
prevalence,
put it in chat, madam. You please put it in chat.
yeah.
Yeah. I will reply to that. Please put it in chat. Meanwhile, we'll move ahead. Now you calculate the sample size for this.
Sir, 39.
39.
39, sir.
39.
Okay. Extremely sorry, I had an urgent call. What is the answer for this exercise?
39.
39.
39.
Can you hear me?
Yes, sir.
Yes, sir. 39.
Yes, sir.
Yes, sir.
Can you hear me?
Yes,
Yes,
sir.
sir.
Okay. What is the answer for this?
The 39.
39.
Okay. What is the answer for this? Okay. Everyone agree to this? Shall I move ahead?
Yes, sir.
Yes, sir.
Okay. What is the answer for this? What is the
24.
answer?
24.
Okay. Now I will request one thing to everyone. Just instead of 4.5, you put 4. Duration of analgesia 4 plus minus 0.4 and see what happens. And tell me what is the output.
Wrong input for a non-inferiority.
Why? You just read there. You will understand.
Hello, sir.
Because 4.2,
Huh.
it should not be less than or equal to 4.2, that M1.
Yeah, because the known drug is giving duration of analgesia equal to 5 hours. Non-inferiority margin is set at 0.8. That means that inferiority will be defined if the new drug gives the value less than 4.2. Is it correct?
Yes, sir.
And if you are saying that already it is 4, already it is inferior, you cannot test for non-inferiority. And that's why this is the output, and this is the only software I've improved upon. Even G-Power doesn't give this type of the check. It mathematically only calculates and gives the wrong output.
Sir, can we
Hello,
say,
sir. Sorry to
sir,
interrupt you.
sir,
Yeah. Huh?
hello?
Can we have this PPT and PDF at the end of the session?
It is recorded. You can take no issue. No issue.
Oh,
Sir,
okay, sir. Thank you.
Sir, can we, in this situation, can we say that there is no need to conduct a clinical trial?
If it is expected as 4,
4,
okay,
expected as 4.
4 and non-inferiority margin is 0.8. In this situation, we are assuming that it is inferior.
Inferior,
Then for what purpose we are conducting non-inferiority design
yes.
trial then? Already, if we are considering before the start, it is inferior.
Yeah.
Yeah. Can I move ahead? Yeah.
Yes, sir.
Yes, sir. Yes, sir.
Last example, and we'll stop. Everybody?
Yes, sir. 20.
Okay. Okay. Thank you. I'll stop here.